Hi, my name is Dr. Jonathan Gelber, and welcome to the World of Wellness podcast. Since this is our first episode, I just wanted to give you a little bit of background about myself and why I decided to start this podcast. I'm a board-certified orthopedic surgeon with an interest in holistic wellness. Many patients who come to see me because their shoulder hurts or their knee hurts. Sometimes they have a meniscus tear or even something in their rotator cuff. When I see patients, we often have a discussion about operative versus non-operative options, and not everybody wants surgery. In fact, sometimes people come in with an MRI or an X-ray, and there's nothing that we can see that we can specifically treat. The reason is there's inflammation. So throughout my years as an orthopedic surgeon, I noticed a lot of patients would come to see me, and sometimes would even get an X-ray, and there would be bone-on-bone arthritis on one knee and barely knee arthritis in the other knee, and it was the knee without the arthritis that hurts. And the reason is because there's inflammation in one knee and not the other. Now, you'll hear a lot about inflammation throughout this podcast series, so I wanted to give you a little bit of sense of what that really means. So inflammation is really your body's response to an injury or something is going wrong. It's kind of like a red alert system. So if you get a cold and your immune system's trying to attack a virus, that's inflammation. You cut your finger and it starts to bleed, and then little platelets go to that area to try to seal off the bleeding. That's part of inflammation. You tear a tendon, you have arthritis, things hurt. That's part of inflammation. In fact, when we're in med school, we learned some simple terms to remember the signs of inflammation. So some signs of inflammation can be redness, swelling, heat, and pain. Now these all go together because it's your body trying to respond to something it doesn't like. It's sort of like when your car is stuck in the snow and the tires are spinning, but it's not getting anywhere. Your body is responding, but it's missing a key piece of that network. So sometimes that can be as simple as an injection. Sometimes that's more like diet and exercise and supplements, but we're trying to turn that red alert system down. Now there's acute inflammation, which can be good. You step on a tack, it hurts. It's a signal to your body that something injured it, and you want to stop and let things heal. But sometimes that signal doesn't get turned off, kind of like those tires spinning in the snow. And that's chronic inflammation, and that's something we need to treat. Some of the things that we're going to talk about in this series include hyperbaric oxygen, infrared laser, supplements. All these things are meant to reduce inflammation. They're trying to get your body to that next level so that it can heal itself. These are the kind of things that we want to look at with this podcast. We want to empower you and your body to heal from inflammation and other injuries. One of the things that I'm a big believer in is something called PRP, or Platelet Rich Plasma. With PRP, we're using your own body's signaling factors to heal tendon injuries or arthritis or other areas that hurt. The way we do this is we draw blood from your arm and we spin it in a centrifuge. When we spin it in the centrifuge, it separates out the red blood cells from the white blood cells and the plasma. In one of those layers are these tiny little cells called platelets. Now, platelets have these little signaling factors inside of them, so when we inject them to an area, they send out these signals and tell other cells to come to that area for healing. What we do is we concentrate these cells and try to get a certain number of cells so that we can get enough of a signal so that there's actually something that heals. That's why not all PRP is the same. So PRP can be used for things like hair growth or skin care, but we use it for joint and tendon problems. And so the number of platelets really matters. So we want to get somewhere around 5 or 10 billion cells. And the way we do that is we have to draw a certain amount of blood. So not all PRP is created equal. A lot of it depends on how many platelets you have, how much blood we draw, what kind of systems we use, and ultimately the total number of platelets in your body's response to them. One thing that I really find PRP useful for is treating arthritis. So arthritis is when cartilage is worn away from the ends of the bones and the bones can start rubbing together. So sometimes if it's the end stage where there's no longer any cartilage left, you might be looking at a knee replacement or even something more traditional like a cortisone injection. But in fact, we know cortisone injections can be bad for your cartilage in the long term. So PRP is something that can actually reduce inflammation. It can even prevent or delay the need for knee replacement surgery. The other thing it can be very useful for is something like tennis elbow. With tennis elbow, there are these small little micro tears that build up in your elbow over time from repetitive movements. Now, your body normally heals these small tears by bringing blood flow and cells to that area to heal. But sometimes, specifically in that area, there's just not a lot of good blood flow. So one thing PRP also does is helps to increase blood flow to certain areas. Because if we get blood flow to those areas, cells can get at that area and then we can heal things. So I wanted to tell you a little bit about a typical conversation I might have when someone comes to see me for knee pain. Oftentimes we'll get an x-ray, maybe there's a little bit of arthritis, maybe we have an MRI that shows something called a degenerative meniscus tear. You might even say a complex meniscus tear, which alarms some people. But in fact, complex just means it's kind of been happening with small little tears over time. It isn't something we need to rush off and do surgery for. So the first thing we want to talk about is reducing inflammation. So you can do that through natural things such as turmeric, tart cherry juice, even fish oil. You can take oral anti-inflammatories, something like meloxicam, which is a once-a-day anti-inflammatory similar to ibuprofen or Advil. Or you can do injections. So injections are a way of delivering anti-inflammatory medicine right to the site of your knee pain. Some of the more traditional ones are cortisone or Toradol. So cortisone is an anti-inflammatory, but it's a steroid. So that steroid component can have some side effects. There's some research that shows that a steroid injection could potentially increase your risk of arthritis in the future. Toradol is a non-steroid anti-inflammatory. So if you're looking for an anti-inflammatory injection without the side effects of steroids, then Toradol might be an option. Also, if you have diabetes, cortisone can temporarily raise your blood sugar. Now there's another injection which insurance companies will sometimes approve. It's called hyaluronic acid. It's a gel injection. And if you have enough arthritis on x-rays and you failed things like physical therapy, sometimes they'll approve that injection. But what's not covered by insurance, and I'm a big believer in, is PRP, or Platelet Rich Plasma. So PRP uses your own body's cells to try and heal the inflammation and try and heal the injury. And if you have something like a degenerative meniscus tear and some arthritis, we can actually treat both of these with the same injection and hopefully avoid surgery. And the other challenge when it comes to treating these type of problems is that there's only really an arthroscopic surgery for the meniscus tear. So the meniscus is a small ring of cartilage that sits between the bones. And because the arthritis that's at the end of the bones is literally rubbing on top of the meniscus, we can't tell what percentage of pain is coming from the meniscus versus the arthritis. And so when we go in arthroscopically and we just smooth out the meniscus, number one, we're taking away some meniscus, which might increase your risk of arthritis and knee replacement in the future. And number two, we're just still leaving the arthritis there. So we haven't done anything to treat that arthritis. When you use PRP, you can actually treat both the arthritis and the meniscus tear at the same time. In fact, they've done some studies now looking at people who've had PRP, and the cartilage might even be thicker after a PRP injection. So PRP is great for treating your pain and injury now, but we might even be looking at PRP as something in the future, so that if you have arthritis, you might even be able to prevent or delay the progression using the PRP. So one of the great things about PRP is that it's not a medication. It's using your own body cells to try and heal things. We simply take some blood, depending on how much we're using, so it might be 1 or 2 of these, which is much less than you even donate blood with, and we put it into a centrifuge, and then we spin that around, and it separates it out into different layers. So the red blood cells and the white blood cells separate out, and then we get a plasma layer. Inside that plasma layer, that's where the platelets are. So we're actually able to take out those platelets and some of that plasma, and then we simply inject that back into the area that's hurting. This whole process takes maybe an hour, and it's done in our office, and you go home the same day. So the way PRP works is inside the platelets are these little signaling factors. And so when we inject the platelets into that area, they release these signaling factors which start a signaling cascade. Basically, it's a signal to tell your body to send cells to that area to try and heal things. Those same signals can also reduce inflammation. So when we're injecting the PRP, we're actually starting a signal. So it's not actually the platelets themselves that do the work, although they do have some anti-inflammatory properties. They're also recruiting other cells to come to that area to try and heal. It's using your own body's cells, so there's nothing outside your body that's going back in from what we took out. It's done under sterile technique, so nothing goes in or out of your body that wasn't there to begin with. Now, one of the great things that we can do here at our office as well is we do these injections under ultrasound guidance. So this way we can actually visualize the joint or the tendon we're trying to treat and put the medicine right there. We can actually see the needle tip as it goes into that tendon or joint and know we're putting the PRP in exactly the right spot. So there's no risks with PRP, but there can be some pain afterwards, and I've seen this very variable. Some people have several days of pain, sort of soreness, like they got punched in the arm or the leg. Some people have no pain at all. But the great thing about PRP is there's not any restrictions like there is after surgery. So with surgery, you might be in a sling for 6 weeks or a knee brace for 6 weeks. With PRP, I simply tell people just to avoid the activities that hurt. If things start to get irritated or inflamed, just back off. It usually lasts only a few days. The PRP's in there, and I think it's doing its job. So some examples of people that I've seen get back to various jobs include sheriffs, stuntmen, even moms and dads getting back to playing with their kids. There are several studies looking at PRP in athletes, and PRP can actually get athletes back to sports sooner, including the NFL and the NBA. PRP is great for a number of different conditions. One, I think, that we can really make use of PRP are partial rotator cuff tears. So rotator cuff tendons are how muscles attach to your shoulder to move it around. So they kind of have the ball here, which is the top of the shoulder, and then the tendon comes in over the front. So you can get a full tear where the tendon's all the way off the bone. We can't get that to heal without surgery, at least not yet. But sometimes there can be a partial tear. So that tear could be just the front part here, where the rest of it's still attached, or it can be inside the tendon itself, where you got the top and the bottom still attached, but then there's a thin layer of a tear in between. Those we can't even see arthroscopically. With PRP, we can inject that area and try to get your body to heal that partial tear. Because there's still some attachment, we don't have to worry about it pulling farther and farther back like we do with a full tear. Because sometimes if we wait too long on a full tear, we can't get it back over with surgery. But with PRP, things are still attached. So if we put some of that medicine in that area, I think we can try to get it to heal on its own. So one question I often get is, what can I do to prepare for a PRP injection? So one thing you can do the day of your PRP injection is do some light to moderate exercise for about 20 to 30 minutes. You want to increase your heart rate so that we can start circulating blood and circulating some platelets, because remember, whatever we're drawing is coming from your blood. So the more platelets that are circulating around, the more platelets we can get and inject back into your joint. The other thing you can try for a few days, maybe a week before your injection, is papaya extract. There's actually some interesting studies looking at papaya extract for patients undergoing chemotherapy, and they can actually increase platelets by taking papaya extract. Another question I get is, are there different types of PRP? And there actually are. So we can do different things depending on how we spin the PRP, whether we spin it once or twice, to create something called leukocyte-rich or leukocyte-poor PRP. So the leukocytes are another type of cell, and part of these cells are white blood cells or neutrophils. And so in certain conditions, we actually want to cause a little bit of inflammation. For example, with tennis elbow, we actually want to increase more of that blood flow to the area. So we might keep some of those neutrophils around. That's called leukocyte-rich PRP. Or for arthritis, we really don't want any inflammation. We don't want to cause any more pain that's already there. So we might do an extra spin and take out those extra leukocytes. That's called leukocyte-poor PRP. And there's actually other cells there too. We talk a lot about platelets, but there's another type of cell called a monocyte, which actually may be important in this whole inflammatory process. So how many injections of PRP should you get? Well, a lot of the research used to show that we would do maybe 2 or 3 injections, but that's before we started to look at the total number of platelets. I had mentioned earlier that the total number of platelets, trying to get a 5 or 10 billion platelets, is important. So now that we know that it's the total number of platelets, we may actually not need to do multiple injections. In fact, if we draw enough blood to get to that 5 or 10 billion platelet number with one injection, hopefully you only need one injection, but you can't always do more injections. Now, I often tell people we should wait at least 6 weeks, though, to see if we're going to see any improvement, because this is a slow process, or it's a signaling process. So it's not like cortisone or Toradol where we inject it and the medicine goes right to a receptor and decreases inflammation. This is a process. Cells have to come, they have to do their thing, and that can take a few weeks. So I recommend waiting at least 6 weeks to see if we start to see some improvement. Now, 6 weeks may not be the maximum improvement. PRP can improve up to a year after an injection, but we should wait at least 6 weeks to decide if the PRP is helping. So PRP alone is great, but you can actually combine PRP with other treatments as well. So of course you can combine it with surgery to increase healing, but some of these non-operative options can also be combined with PRP. So we talked a little bit earlier about viscosupplementation or gel injections. So those are sometimes covered by insurance for arthritis. So we can inject that at the same time as a PRP or stagger them. Do one and then a few weeks later do the other. Because if you can get the insurance to cover the gel injections, I recommend that. However, if you're going to pay out of pocket, I think the PRP is better. And even though it's not covered by insurance, I think it's more effective. In fact, studies are showing that it's a bit more effective than the gel or hyaluronic acid injections. The other thing that we can do is actually activate the platelets with light. So there's something called photoactivation. So if you actually hit the cells with some light, they might activate the platelets and they might release more of those signaling factors, making them more effective. So we can actually do that with an infrared laser here in our office. You can combine the PRP with infrared laser. Another interesting combination is looking at the knee as an organ. So we're often thinking about, okay, just what's the inside? But there's actually an outside to the knee as well. So the bones are the outside. So the PRP is treating the cartilage on the inside of the knee. But if you look at an MRI with someone with arthritis, there might be some swelling or other things going on with the bone. So there are some other techniques now where we're putting PRP inside the knee, but we're also injecting things into bone, such as PRP or bone marrow. So that way we're treating both sides of the knee joint, the cartilage on the inside and also the bones on the outside. Another question I get in the office is about medications and PRP. So if you're on a blood thinner, then we shouldn't do the PRP because that might interfere with your blood thinner activity. But the other thing we want to look at is anti-inflammatory medications because they can actually have an effect on the platelets. So you want to stop ibuprofen, Advil, naproxen, or a lot of other anti-inflammatories a few weeks before and even a few weeks after your injection. However, there are some anti-inflammatories that have less of an effect on the platelets. For example, meloxicam or Mobic, which is the once-a-day anti-inflammatory, or even Celebrex because it works through a different pathway. So while you should try to avoid anti-inflammatories, there are a few that you can take if you need to, but they should be the specific ones that have a less effect on the platelets. So PRP is not brand new, but our understanding of it through science is growing. In fact, there's more research now to show that PRP is more effective for knee arthritis than cortisone. Over 1,000 studies now are available looking at PRP. And so while it's not new, how we're doing it is growing and becoming even more precise. So overall, I think PRP is a great treatment option. I'm a big believer in PRP. In fact, with PRP, we can often avoid or even delay surgery. So even though it's not yet covered by insurance, I think it's often worth the expense. Because I think if we can save you from having a surgery and not have any restrictions afterwards, I think that's a great treatment option. So PRP is a strong part of my philosophy for treating your body holistically. As we mentioned, the World of Wellness podcast is focusing on how we can utilize your body's own healing capabilities to reduce inflammation and treat injuries. PRP does exactly that. Our philosophy here at LA Ortho and Wellness is to work with you and to give you options. Now, obviously, if surgery has to happen, we'll tell you that, but oftentimes we can try to avoid surgery, and that's why we look at these other alternatives like PRP. We also have other amazing things here like infrared laser, hyperbaric oxygen, even supplements, because anything that we can do to reduce inflammation is going to make your pain go away. On the next few episodes of the World of Wellness podcast, we're going to explore some of these other options that we have here at LA Ortho and Wellness, as well as some other things. They might include hyperbaric oxygen, infrared laser, even music therapy. And also really interesting is looking at your gut microbiome and how that can cause inflammation and maybe arthritis. A few years ago, as an orthopedic surgeon, if someone would have told me, the bacteria inside your intestines can lead to arthritis inflammation, I would have said they're crazy. But there's actually a lot of research now coming out that's showing the microbiome and the bacteria in your gut can cause many diseases. And through inflammation, arthritis. In fact, inflammation can cause body parts to have lots of different problems, whether it's diabetes with kidneys, Alzheimer's in the brain. It just so happens that I'm an orthopedic surgeon, so I see knee pain and joint pain and arthritis. But it's all coming from the gut. And if we can treat your gut inflammation, we can even make your knee pain go away. Thanks for listening to this episode of the World of Wellness podcast. Don't forget to subscribe and leave your questions below in the comments section. I'll try to answer them in upcoming episodes as we go on this journey together.